Hello and welcome back to Hill and Ponton's YouTube live channel. I am attorney Allison Reddick and I am with the fabulous attorney Shelly Mark. How are you doing, Shelly?
I'm doing great. Allison, how are you?
Good. I don't know if we've ever done a live together. This is very exciting.
I don't think we have. Yes.
So we are ready for your questions and we will answer as many as we can in the next hour. So let's get started.
Okay.
Okay, at Tammy D9755, can you get state home health care and the VA caregiver program at the same time if you need both? That's a good question.
It is.
I would think yes, but I'm not sure. I don't know. I'm thinking in the terms of the VA caregiver is a benefit that is paid directly to your caregiver. So it's not something going to the veteran. But I don't know the answer to that.
I wish I could add, Allison, but I think I'm with you. I think that depends on what kind of state home health care you're really asking about. If it's, if the veteran is being provided care like in a facility or something like that, then you're going to have a hard time with the caregiver program. But if it's just services provided to them through home health, I think you'd be okay with that and the caregiver.
It also depends on what state you're in, because every single state is going to have different requirements. Like for your caregiver, it's really someone who's having to help you all of the time with your activities of daily living. And maybe some states allow for you to have someone else come in and help you so your caregiver can go and do whatever outside tasks that they need to do. So that would be something that you would need to look specifically at your state. But I can see ways, I think we both can see ways where potentially you could be able to receive both. Okay, at Teeth Hirsch 102, my EMG doctor diagnosed carpal tunnel syndrome of moderate degree to both hands. The VA granted 10% left and 10% right. I filed a higher level appeal for an increased rating since EMG doctor's diagnosis clearly stated moderate, which matches the language of DC 8515. And I've also requested VA consider bilateral factor. Shouldn't VA automatically apply bilateral factor when both extremities are involved? Thanks for all the help you provide with these sessions. So yes, so the way to see if the bilateral factor was applied would be to look at your rating sheet. You can go in your e-benefits and look for that. It's called a rating sheet. It'll have all of your service-connected conditions listed, and then it'll have your combined rating. And then next to your combined rating, it'll show what bilateral factor is being used, whether it's 4.0 or 1.6. So that should be included. They don't necessarily say it in the decision, but you can check with your rating sheet. And yeah, I agree. If your EMG is saying moderate in both, absolutely file a higher level review and see if they will increase that based on the diagnostic criteria. Because with nerve issues, it's really the language: mild, moderate, moderately severe, or severe with atrophy. So I agree with your assessment. Anything to add, Shelly?
No, I think you covered it.
Okay, let's keep going. At Mark Anthony Rossi 8476, can your firm help with getting the VA to recognize there are other bases like Beale Air Force Base? I filed and believe I will be denied solely for that reason.
So interesting question. We do a lot of exposure cases, as all of you guys know, and we are always open to looking at new bases or any information that you have. Whether or not we can get the VA to recognize the actual base and concede something, that's a little bit over, probably more than what we can do. But you can, that would have to be changed through legislation that would come down to the VA. However, that doesn't mean that we can't file a claim on your behalf and help you develop it for whatever exposure it is that you feel was at that base. And then in time, if there are other people that have similar exposure or similar conditions, we can at least expose the VA to the fact that there is exposure at this base, that we're able to provide positive nexus opinions and get people service connected for it, so that at least it's on their radar. And then hopefully that would turn into legislation one day that would then come down to the VA to say, this person was at Beale Air Force Base, so therefore we're conceding this exposure. But it's a little bit of a process. But it does not mean that well, is it likely that the claim's going to be denied initially? Yes. But it doesn't mean that it can't be developed.
I think also important to note is with the PACT Act that they're supposed to do TERA analysis, toxic exposure risk assessment. And so when I get one back where they didn't consider the base, sometimes I'll file a higher level review and say, this base is known to have toxic exposure. It's a known Superfund site. Please redo the TERA assessment. Or like Shelly said, it's most likely to get denied. But if you can prove that those chemicals or exposures were there through, articles, through the EPA, et cetera, and you can get a nexus opinion, you can always go the direct route. With the exposures for like Camp Lejeune and Thailand, Agent Orange, Vietnam, those are presumptive, but that doesn't mean you can't prove something directly. So absolutely file for it and just try to gather as much information as you can about the exposures, be specific. If you find articles which say the exposures were in these areas, show that how you were in those areas and how you were exposed and you had no personal protective equipment, et cetera.
I agree. And to reinforce what Allison said, in doing so, statements are super useful. So if you can provide a statement to the VA, what were you doing? Where were you at? What things were you coming in contact with on a regular basis? It's very helpful.
Okay, at James G 6109, Part 1, 2026 rated 50% for PTSD, 2018 100% permanent in total. I have major hygiene issues. My wife takes care of me. It's led to dental issues, body sores. At all my VA appointments, they say I am clean. My wife forces me and helps me to get ready. How do we write strong statements showing this? Also have evidence of being a suicide risk by multiple ER locations, using PTSD alone to go for aid and attendance. Is equine therapy a way to help show severe PTSD? I received ear acupuncture for PTSD and use Calmingo device. I am tired of taking pills. I have been on 28 meds at one time. I'm not even 45 yet. Okay, so I think the question is getting aid and attendance via PTSD. You're at 100%. So you qualify for consideration for aid and attendance. Now they will tell you that you need 100% rating for one condition. That's not true. There's no regulation for that. My question would be, have you filed a aid and attendance form, a 2680, discussing how all of these issues? I mean, that's really how you're going to get aid and attendance, is you need a 2680 form. If you don't have 100% rating for one condition, they're not going to just do that exam for you by just asking for it. Shelly, what do you think?
Yeah, I agree. First step is to file it. And if you can get the 2680 completed by a doctor, then that's fantastic, and get it filed. You want supportive statements. Again, if your wife is really providing all of those services and she's helping you with everything throughout the day like that, that's exactly what you want to get in the file. So a strong statement from her about what things you need assistance with. It sounds like a very clear case for aid and attendance to me. But you definitely need to get it filed. As Allison said, they're usually not going to just initiate that for you, unfortunately.
And you don't need to just do the PTSD. I mean, it may be, especially since you have only 50% rating for that, if you can add other conditions. But if you're trying to go by Barry steps, I see why you're trying to just get it based on PTSD. So if you're trying to increase the PTSD first, yeah, strong statements from you, from your spouse, friends, family, anyone who sees how she takes care of you, anyone who sees your appearance, etc. Start with those. And then if you're trying to go for the aid and attendance, then file the 2680. And at some point you may just need to get a nexus opinion supporting the aid and attendance, if VA isn't willing to do an examination.
Yeah, I agree.
Okay, at Richard Unknown. I would like to thank you all for the information and guidance you offer. You're very welcome. After 3 years, April 2023, I finally got approved for obstructive sleep apnea at 50%. That's wonderful. Also, since listening to y'all, I have gotten to 100% permanent and total for PTSD, 50% for migraines, 30% for chronic sinusitis, 0% for hypothyroidism, granted IU and I am SMCS currently. Now the only 2 claims left are palsy neuropathy and aid and attendance. Thank you guys. That's wonderful.
That's really great. Congratulations.
I love to hear when veterans are able to get to 100% on their own. You all really should be able to do this without an attorney. They've made the system so convoluted and so difficult to navigate, and they deny hoping people give up. So that is amazing. For the neuropathy, that can help you get with the aid and attendance. And like we just said before, file the 2680 and you can go from there and try to get Berry steps to get higher SMC. But that is absolutely amazing. I'm very happy for you. And
that's great. Congratulations. Wonderful.
Yes, congratulations.
It's not easy to do. So
no,
should be very proud.
Yes, absolutely. 1,000%. That's amazing. Okay. At T Hirsch 102. Okay. April 1st, BVA decided my genetic blood disorder is a disease because it manifested in service. They remanded it to the RO for consideration of agitation or aggravation. May 21st, RO denied because it existed prior to service, but did not address the issue of agitation, which I'm assuming is aggravation. I filed a CAR, claims accuracy review, asking for service connection or consideration of aggravation. If the VA denies it again, I assume I should go directly to the BVA. What's the likelihood the BVA will remand it again?
This one for me, Allison, I think so. First, I think if you go back up to the board after that denial, they will remand it again because they're going to have to push the RO to actually give you an evaluation based on aggravation. I would like to see you probably develop that a little bit more before you go up to the board. I would recommend that you get a nexus letter, some statement about the aggravation and what pre-existed service, whatever you were treated for or exposed to, or whatever happened during service and where you're at now. And then an opinion linking all of that together and describing the aggravation, get that into the regional office. And they may deny it again, and that's fine. Then you can take it up to the board. And then you have a chance that the board judges can actually grant it and not have to remand it back down. Because the thing is, if they remand it back down again, the likelihood that they're going to properly evaluate it for aggravation isn't really any higher than it was this time. So before I would go up to the board. I would definitely do a little bit of development and try to get a nexus letter. But that's just my opinion too.
I agree. I agree. Also, how old are you? Are you 75 or older? Then you can develop and go in the evidence lane and get a nexus and go up to the board and have a more likelihood of it getting granted. If you're under 75, I agree with Shelly. I would develop in the supplemental lane. So you add you appeal the decision in the supplemental lane with that nexus opinion. And then if it's denied, which most likely it will, then you set yourself up to go to the direct review lane at the board. Since they didn't consider the aggravation, it's possible they can remand it again. But if you're giving them the evidence that they need, you're more likely to get it granted. But yeah, I agree. Try to develop it a little more and get a nexus opinion. Okay, Just Dave 65. I had a couple of denials on my last claim that I believe there was a questionable C&P. He just went really, really fast and didn't really interact when I tried to talk to him about things. Is that it?
I guess.
Okay.
I think
if that's it, that's fine. Welcome to C&P exams. They are usually not great. Sometimes you'll get someone good. But if you're having issues with the C&P exam, you can always write a statement, appealing it, expressing exactly what happened. I always recommend, if they allow it, to have someone go to the C&P exam with you. So then you also have someone to corroborate what happened. There is a follow-up and they are pulling it. Okay, I had some denials. Check the C file so I could see the C&P info. I ordered my file June 4th, 2025. It's still sitting and received. I've called and sent messages. How can I write a decent appeal? Wow, you ordered it a year ago. And unfortunately, FOIA requests for C files can take a year, if not longer. If you're coming up on your date for denial, I would appeal with statements discussing how the C&P examination was, what you disagreed with it, but also what does the decision say? Is it just that it's because they provided a negative nexus opinion? Definitely thoroughly read the decision, because sometimes it'll tell you in there, it'll give the medical opinion that the examiner provided and why they denied it or not. Also, is there another theory of entitlement you could try? Direct service connection to me is way harder than secondary service connection. Are these issues something that you could potentially get secondary? But just based off of this information, I would at least write a statement discussing the C&P examination and asking for a new one.
Mm-hmm. Yeah, I agree.
Okay, at Danny Atlanta, Hill and Ponton, I'm rated 10% for residuals of an in-service right foot bunionectomy and 10% for the scar. I now have chronic pain with standing, walking, weight bearing. I hear that is a very painful surgery. My orthopedic surgeon diagnosed arthritis and hallux rigidus of the first MTP, metatarsal joint. I also have pain when bending the great toe and pain along the underside of the toe forefoot. Since 10% is the maximum rating for hallux valgus after surgery, should I file the arthritis and hallux rigidus as secondary conditions or request an increased rating for all residuals? Can VA rate these separately without pyramiding if they cause distinct functional impairment? What medical evidence or wording should I obtain from my orthopedic surgeon before filing?
Okay, well, this is a very kind of normal secondary claim, like what we were just talking about. And Allison mentioned that sometimes the secondary claims are a little easier than direct. Can you flip back to the 3 out of 4? Thank you. I would definitely file the arthritis and the hallux rigidus as secondary to the underlying condition. You could ask for an increased rating of the direct service-connected condition, but if 10% is the max rating, you're probably not going to get it there. And I would build on the secondary claims. I would also, are you having any difficulties with your knees? Are you having hip issues? Is there anything going on with your back? And try to build the claim with any orthopedic issues that you're having that you could argue are secondary to a change in your gait or something that's coming from this underlying condition. And then I would ask the orthopedic doctor to address just that. Here are the issues that I'm having. Could these possibly be related to this underlying service-connected conditions, like your knees? Absolutely. And then get a good opinion from the orthopedic doctor, and argue all of those conditions as secondary. We talk a lot on here too about, like, it's not just physical. Like, if you're having anxiety, depression, if you're not able to do the things that you used to be able to do because of these things, that is also a secondary claim. It doesn't matter that it's to an orthopedic claim. So I would definitely sit down and think about anything that could be related. It sounds like that max 10% rating is not properly compensating you for the impact. And exploring those secondary conditions may be a way to actually get you the proper compensation. So yes, I would absolutely file it.
And with the wording for the doctor, I would say, she has this condition, the original one, the hallux valgus, and the doctor specifically says in the letter that the other conditions are secondary to. The arthritis is secondary to the hallux valgus, the secondary to the rigidus, all of that. The knees, if they'll include the knees too, because if it affects the way you walk, it can affect the knees. Anything that the doctor will include, but absolutely file the secondary claims. And if they are still giving you trouble with the limited ratings, you can always try to ask for an analogous rating, since it's not considering the functional impact, but that's definitely more difficult. I would, as Shelly said, try with the secondary issues first. Okay, step by step 889, BVA timeline question for direct docket, advance on the docket claim, submitted, advance on the docket, NOD 4/14/26, got lost in their system, surprise, until 6/10 audit review open, and 6/12 claim established today, appeal distributed to VLJ. Veterans Law Judge. With the advance on the docket granted, what can we expect on a timeline to completion? And if granted, what happens next? SMCT claim, as well as earlier effective date to filing date of 2/4/2019. Can you go back to the first part? Okay, so you filed it in April 26, your advance on the docket, and then now they're saying they found it, and in June of 2012. So they just changed it. Like, if you're represented, and your representative used to be able to go into case flow and we could see where it was exactly and what the status was. Like, it's assigned to an attorney or it's pending a decision. Well, they didn't like us having that much information, so they just took that away. And so now all we can do is kind of see the same as you, whereas it's been distributed or assigned to someone on a certain date. It really depends on the judge that it's assigned to. Some of them turn them around in a month. Some of them take 3 months. Some of them take 6 months. But since you're advanced on the docket, I would hope it would be less than 6 months. I would hope it would be less than 3 months. Are you seeing anything different with direct review? Because I used to see it was moving really fast, and now it's slowing down a little, even with advanced on the docket. Like, I would get decisions within a few weeks, and now it's like a month, 2 months, 3 months, 4, up to 6.
It varies so much. That's why it's so hard for us to give you a timeline, because, like Allison said, I mean, there was a period, I think it was last year, where we would file a direct advanced on the docket and we would literally get a decision within 30 or 60 days. It was crazy. And then we have some that we file and it's 6 months. So it's really hard to give any kind of time frame. I do agree with Allison, though, that if you have an advance on the docket, I would hope that it's not much more than 6 months. I don't think that it would be. It is not helpful to us that we have now lost that access in case flow, and now we are not able to provide you guys with any more information like we could before. I was hoping that was going to be like a mistake and they were going to go back and fix that. I'm still
No, I
hopeful.
think they would be like, oh, I've seen this as pending signature for over a month. What's going on?
Mhm.
So
Right.
they were like, let's take that away so they can stop asking us so many questions. And with the board lanes, they shift to whichever one they're the most behind in, except for hearing lane.
Right.
For evidence lane and direct, like they were going really hard on evidence lane last year, and then they got caught up. So then they started going really hard on, or direct lane, and then so they started going really hard on evidence lane. And now I don't know where they are because we can't really see as much as we could before. But yeah, I would hope it would be less than 6 months since you're advanced on the docket. Hopefully less than 3, but it depends on the judge it's assigned to and just what their backlog is. But it should be at the top of their stack.
And Allison, I think he asked what the process is after.
Oh, yes.
So the judge will issue a decision, and then it'll either be a denial, a grant, or a remand. And depending on whatever it is, if there's a denial, then you'll have to review it and see as far as any further appeals. And then if it's a remand or a grant, it goes back to the regional office. If it's a remand, it probably means that they're asking for some type of development, whether it's going to be an exam or something. And so it's going to go back to the regional office, and they're going to have to set that up and develop and follow the board's instructions and then issue a new decision. If it's a grant of benefits, and that's hopefully what you get, it's just an outright grant, then it's just going to go back to the regional office for them to implement it and issue a rating decision. And again, that time frame varies like a lot. It's hard to say how long that will take, but I'm going to say it shouldn't take 3 to 6 months, hopefully not that long.
And just because you're advanced on the docket at the board doesn't mean you're advanced on the docket at the regional office. So you could be 79, 80 years old and advanced at the board. You come back down to the regional office. If you're not 85 or older, they don't care. But if it is a grant, it should be turned around quickly, at least giving you something. And then if they need new exams later. But yeah, with the Appeals Modernization Act, their big thing was, we're going to do less remands. This is less remands. I have not been seeing less remands. I've been like, it's insane. It's like, that's what they wanted to do. But then they got so overwhelmed with the amount of appeals that they're using remands to get their numbers, in my opinion. I'm seeing lots of remands. I hope that doesn't happen for you. I hope that they grant it. But if they do deny it, then if it's it goes back to 2019. So yeah, Appeals Modernization Act, you can go to the CAVC or you can file a supplemental appeal at the regional office to keep that effective date. So hopefully you won't be waiting too much longer, and maybe you'll have a decision in one of the upcoming lives and you can let us know how it went. Okay, another step, 25. A friend served as a hometown recruiter prior to reporting to her first busy station. She had bad migraines and went to a civilian doctor. This was in the late 80s. And she doesn't have records. Can she still claim without medical evidence? Thank you. You've been great help to me. And now I'm trying to help others. So that's great. That's wonderful.
Oh, that's wonderful. That's awesome. I think I understand the question to be that she was being treated for migraines, doesn't really have the documentation, and wants to know. So I would say that there are other ways potentially that you could develop the case. If you could use statements. Was she communicating this to anybody else? Did she have a spouse? Maybe that she was discussing her symptoms with, or family members that she was writing home to, or having discussions about the migraines that she was having. I think that's one avenue. If, she could look up and get the records from that private doctor, that would be great. But considering that's from the 80s, I doubt that that's going to be an option. So you're just going to have to get creative with how to develop that. Of course, if she's still in contact with anybody that she served with, that could also provide a statement saying, yes, I recall she was having these migraines, then you could absolutely use that too. Allison, any other ideas on how to?
Secondary service connection. Is there
True.
anything she's service connected for that she could get secondary? I mean, lots of medications, side effects or migraines, PTSD, mental health issues, side effects or migraines, neck issues, side effects or migraines. If it's just direct, I agree with Shelly, getting buddy statements to show that you had symptoms back then, people that witnessed you experiencing these migraines, and then showing continuity of care that you've had those migraines since then, since it was the 80s, because they're going to say, well, it's been so long, it's probably due to something else. So yeah, I don't think you're going to be able to get those records, but I don't think that negates a claim. You can still file a claim and develop lay testimony, because that's supposed to be viewed just as medical evidence is to be viewed.
Right. And I think, Allison, I don't know if you mentioned this. If so, I apologize. Tinnitus.
No, I did not. That's a great one.
Don't think about when it comes to the migraines, but if you're experiencing migraines along with that, then you definitely want to file that as secondary as well.
Absolutely. That's a big one. Okay. Charlie Swift. Hello, H&P team. I was recently denied VBA appeal for my back, for which I'm currently rated at 40%. The attorneys for the VSO picked up my appeal and is going to fight it at the Court of Appeal. Okay. From my evidence, they stated I should have gotten a higher rating as well as SMC. Is this a winnable claim if it gets noticed by the attorneys with the VSO reps? So for me, usually 40% is what you're going to max out at with the back, unless you have ankylosis, which basically means you can't move it at all. So if you have evidence of ankylosis in your records, the doctor says you have ankylosis, then yeah, absolutely, you can get a higher rating. I've never seen higher than 50%. Have you seen higher for a back?
Honestly, usually what we see as the highest is 40%.
Yeah.
Almost across the board.
But if you have ankylosis, then yeah, you are entitled to a higher rating. It's just that's something that is very severe, that not a lot of people have that diagnosis. But if you have it, absolutely, it's winnable. But without that, 40 is usually the maximum we see. Okay, James G6109. What 2 SMCL approvals have you seen win for people not missing limbs? I have PTSD, TBI residuals, not rated yet for TBI, and physical. I use a cane issued toilet adjuster, handicap placards, and over 300 chiro and acupuncture visits from VA community care. I have severe migraines, take Nurtec. I like Nurtec. I take that too. And I am getting evaluated for a gamma core device or other devices, only rated 30%. Oh, wow.
Oh, that's low.
Yeah. I would definitely say you should probably have an increased rating for the migraines. Can you go back to the first part?
Yeah, I agree with that. That sounds, you should be at 50% for the migraines. I'm assuming that he's already at 100. I'm assuming that since he's looking at the SMCs.
We will assume yes.
Okay.
I've seen what physical issues are there, because yeah, you can get 2 SMCLs, one for the mental TBI or PTSD and one for physical. But whatever, like the TBI, depending on if you haven't been rated yet for it, depending on how severe your TBI residuals are, you may not need 2 Ls, because the legislation has carved out their own SMC for TBI, which is SMCT, which is the equivalent of like SMC R2 or R1. I think it's R2. So first I would see what you get rated for your TBI residuals. If you're not having, and if it's a lot of overlap with the PTSD, that's okay. For the TBI residuals, it's basically whether you can sustain in society without assistance or monitoring. So like, but for whomever is helping care for you, your spouse, family member, or if you're in a nursing home, you would be in a nursing home or some kind of institution. So first I would wait to see what happens with the TBI residuals, even if it is combined with the PTSD, because you may be able to go with the SMCT route. If not, I would say you could get 1L for mental and then 1L for physical.
I agree, Allison. That's what I would think. That's probably the most common. And
it's really hard for us to discuss SMC levels without seeing every single rating and every single percentage. And like, if you are at 100%, are you at 100% for one condition? Are you at 100% through TDIU? Because there's so many different ways that you can finesse to get to a higher level of SMC through the Berry steps, which we discussed in prior videos. Okay, Jean CLO. My liver cancer has been reduced to 0% because I am in remission. The end of the decision says, since there is a likelihood of improvement, the assigned evaluation is not reduced from 100% to 0. Go to remission from liver cancer. Can the VA still call me in for a yearly C&P exam?
Can you guys go back to the first slide? Okay, so they reduced him to 0 because he's in remission. I'm not sure if he has a rating for his residuals. I certainly hope so. And if not, I would definitely work on that and, go through and are you having any residuals that they need to rate? Even though it's not active anymore, it doesn't mean that you shouldn't be compensated for those. So if you are, then the 0% rating is not correct. So you definitely want to work on that. If it's at 0, they're not going to be bringing you in for C&P exams either. So I don't think you need to worry about that. With the residuals, if you establish the residuals, I would assume that they're going to find those to be static. I don't think that they're going to be bringing you in for C&Ps on that either. They do consistently or order future exams for cancer because there is a likelihood of improvement, and they want to see if the cancer goes into remission because the cancer is rated at 100% anytime that it's active. And then after that, it's based on the residuals. So I would be less concerned with any future C&P exams and more concerned with getting you properly rated for your residuals.
Yeah, I agree. If you're at 0, they're not going to be like, oh, come in for an exam. Let's see if we can get you a higher rating. Like, no, they only want to reduce your ratings. So you have to advocate for yourself and appeal that 0% rating. Like Shelly said, I mean, what are you having any residual issues from the treatment that you had for liver cancer? Are you having severe fatigue? Do you have migraines? Did you have to have like chemotherapy and you developed neuropathy from it? Do you have cirrhosis of the liver? There are all kinds of things that could be due to or could be a residual of the cancer. And sometimes they'll just give you 0% because they think that people won't appeal it and they'll just accept the 0%. So go and think about any issues that you didn't have before you had cancer, and then you had the cancer and you either had surgery or you received radiation or chemotherapy or immunosuppressant, something. And now you have these residual issues that are due to the cancer. You should receive ratings for those. So at this point, the ball is in your court to advocate for yourself and appeal it and let them know, no, I still have these issues and it's due to my liver cancer. I'm entitled to a compensable rating. And then, of course, if it does come back, and once you get the pathology, you send that in, and that should go back to the 100%. But don't sit with the 0% rating just because they gave you 0% rating. If you have issues that were not there before the cancer, then those are residual issues, in my opinion. Okay, James G. 6 109. My VA doc was going to do a 212680. That's the aid and attendance form. And now that I have been approved for community care PCP, she no longer wants to do it. Surprise. How do I get her to see on Friday that it makes no sense to ask a new doc I do not know to do a 2680 the first time I meet him? Do raters, HLR, or the board look at messages to VA records? I have a social worker at VA who is helping me fight for aid and attendance. You can file those messages. Absolutely. I don't know if they specifically look at them, and they should be in your Capri records for the VA, but I'm surprised that the VA doctor said at first that she would do it, because I rarely see VA doctors wanting to do 2680 forms. Sometimes there's good ones, but now she's kind of like, I have an out. So yeah, I mean, I would ask her about that, especially if she's been treating you for a while. But also, once you see this new doctor, if they're willing to do it, that's fine too. I understand where you're coming from in that this person has treated you longer, but think about when you go to a CMP exam, they've only seen you once. I don't think that changes the weight of the opinion. I would just try to get the 2680 in any way you can, and also include those messages through Capri or wherever, where the social worker is also stating that you should have aid and attendance, and that would be helpful evidence as well.
Yeah, and just a note on the messages back and forth, I will say sometimes we do see those in the file.
Mhm.
So just maybe be mindful of that sometimes, and what you might be sending back and forth in communication. I am certain for the most part, nothing would be negatively impacting your claims, but we have had a couple where we're like, oh, didn't necessarily need to give that information out. So I don't think they're included all the time. I agree with Allison though. If you think they're helpful, you should absolutely submit them.
Okay, JP 29126, reserves. Got hurt on Title 10 orders with LOD and workers' comp, line of duty determination and workers' comp form that the hospital filled out. Nexus with highly likely, denied 3 times. HLR says DTA, good or bad?
I say good, definitely. So they're recognizing an error in their development. I'm going to assume that they haven't properly considered the nexus letter that you've submitted, and that is what they're doing, hopefully, or maybe requesting a proper opinion. Hopefully an exam that you don't have to attend again. I try to tell clients that if they're just looking for an ACE exam or an updated medical opinion, you don't have to go to those. I'm not going to advise you not to go to your CMP exams if they schedule it, but it's worth a ask when they call you to say, hey, is this one I have to go to, or is this just an opinion? Because in a situation like this, after 3 denials and a nexus letter, there should already be previous examinations and opinions in the file. Either way, a DTA is good. It means that they are continuing to develop, and they're actually acknowledging the fact that they've made errors. So that's a good thing.
I agree. Okay, 1LTUS MCR. I have aid and attendance and 5 additional disabilities rated at 50% or more plus SMCK. How many berry bumps are needed to achieve SMCO and then R1? I have a few that add to 50% using straight, not VA math. Okay, so it depends on what you are using to get the aid and attendance, because anything that you use to get in the aid and attendance, you cannot use for the berry steps. So like if you have one condition that's 100% or one condition that is more disabling, like Parkinson's, heart disease, fibromyalgia, MS, any of those, you need to focus on getting the aid and attendance for one, maybe 2 issues, and then use all of the other ones. So in this scenario, I don't know, I can't really give you specifics, but you're going to need, okay, you have an L, so you need to get to M, N, O. So 50% gives you a half step. So you would need 6 6 50% ratings to get you up to O, which basically gets you to R because you already have the aid in attendance. Or if you have any additional 100% ratings, like sometimes I'll see someone has 100% for a cancer or a heart condition or fibromyalgia, things like that, then any additional 100% rating mental health, that is a full step. So you either need 6 half steps or 3 full steps or a combination of both. But it really depends on what you put on the aid and attendance form. You can also try for 2 L's, which would be 2 different aid and attendances, but you have to show how they would be for different things, that you would need aid and attendance for, bilateral lower extremity because you need help transferring or getting dressed or putting your shoes on, and then another aid and attendance for something else, usually like mental health or something where you need supervision, medication management, things like that. But so let's see, you have 5. Okay, let's say you have the aid and attendance for just one thing and then 5 additional. So that would get you to 50-50 M, 50-50 N, and then you'd be at N.5. Plus the SMCK, that kind of potentially could get you there. But I don't know without seeing the specifics.
I would want to know what those 50% are for, because I don't think the easier route may be what Allison was saying, is get the 2 L's, get the aid and attendance separately. So if you have a back condition, like we were talking about earlier in the recording, that's like 60%, like you are really unable to provide for yourself. But then you also have mental health where you definitely need aid and attendance, both of those separately, then you could get those 2. And that would give you the O for the R1. I believe I'm saying that correctly. But the two for separate conditions for aid and attendance, or of course, like Allison said, the half steps.
But I think like what you're saying here, if you have aid and attendance and then those 50% ratings are not being included in that aid and attendance, what you have right here qualifies you for O, because if you get to N.5, which you're at with these 50% rating, assuming that they are not associated with the aid and attendance, that SMCK can get you that last half step to O. So based on this, it just depends on if those 50% ratings are being included in the aid and attendance or not. If they are not, then what you have right here qualifies to get you to O. And then R1. Because to get to R1, you just have to show that you need aid and attendance, which you already have. So I would be interested to know if, what's being included in the aid and attendance or not. Because if it's not, then yeah, I would appeal and say that you should have the Berry steps up to R1. I've done a couple Berry steps where I've gotten all the way up. I have one pending at the board. I know Rachel has done a lot. So yeah, the Berry steps are really helpful. It's just getting the aid. What makes it difficult is that you're trying to get aid and attendance. So you just put whatever you can on there, and then you get all these conditions. And then you're like, wait, but I need to use those conditions for the steps and not the aid and attendance. And then you kind of have to separate it out and start over. But it is possible. Okay, James G 6109. Right now, with all of my conditions, I get to M.5 or N with 50% combined half steps. I have vertigo, 30%, IBS, 30%, migraines to 50, TBI, 40%. I get N.5. I already have SMCK. Which claim do you suggest I go for first? I work 5 to 15 hours a week, not interested in SMCT. Thank you for all that you do. Okay, so go back.
Yeah. So he's saying that he's already at M.5, or is he asking to get there? Right now, with all my conditions, I get to M.5 for M.
And then with those additional ones, he gets to M.5, and he already has SMCK.
That's what I'm reading. That would be like the one that we just discussed, correct?
Correct. Well, okay, so you can combine other ratings together to get to the 50%. So the migraine's on its own is 50, so that would be an extra half step. And then you can combine other ones like the vertigo and the IBS together to get to another 50%. And then you already have SMCK. So if you already have the SMCK, yeah, you just need to get to N.5. But again, it's really hard for us to do the mental gymnastics of this without seeing the rating sheet and what specifically you have the aid and attendance for versus the additional steps. So, but yeah, you can combine issues too. So like you can use the vertigo and the IBS, the TBI, or if you have like TBI for 40%, you have tinnitus for 10%, you can put those together to get to a 50%. You can get creative with it. Okay, Old Wood Rat, greetings. BDD claim 30 years ago for aggravation of knee condition denied, so no aggravation. Did have an in-service med board for a permanent profile, now granted with no new evidence. Q? Q claims.
Good question. Yeah. Is that the end? I think so. That is a very good question that we unfortunately would not be able to answer without looking into the file and figuring out why the claim was originally denied and if there were any issues that would rise to the level of a Q, which is not easy to do. It's a difficult standard to prove, but it is interesting that it was granted without you adding anything to the file. So, I mean, it would definitely be worth taking a look at and then seeing if there's any way to argue it back. It's very difficult to say without looking really closely at all the facts, though.
Yeah, and I mean, like, Q is really hard. First, I would look to see, like, why did they grant it with nothing else? Was it because new service records were added to the file that weren't there before? That would be a 3.156C analysis where you can go and reopen it. Or back when you filed and it was denied, was any new evidence that would have been relevant to it added within the year of the decision added? That would be a 3.156B. It's kind of a long drawn out analysis that we go through step by step to go through all the different loopholes to where it could be. But for Q, it has to be that like a glaringly obvious error where they're like, it's obvious to anyone that they should have granted it when they didn't. I always look for the other like 3.156B, C first, and then like go for Q, but we don't know without seeing the file and going through page by page. I would, you could always reach out to a representative and ask them to review the file if you think that there's something there. But a lot of times when it's denied and there's no appeal and there's nothing glaringly there, there's not really anything we can do about it. But with this, since it was granted with no new evidence, I'm like, were there new service record added? Is that
something?
Yeah, something changed.
Yeah.
Okay. Lawrence McKenzie 7556. Hello. 30% through the PACT Act, but the military says my medical records are lost. Lies. I had copies of med records and turned them into the Lake Baldwin Orlando Clinic years ago. Lawyer needed. Sorry. Did you keep the records though? Did you give them copies? Because I would be nervous that they didn't actually upload them into your file.
Yeah. I also, we hear this a lot when people say, they're telling me that my records are lost, and then we get a copy of the file and we're like, I have your records right here. So
Mhm.
I think that there's sometimes a disconnection there. They may be telling you that they don't think that the specific records that you're describing, they may say, well, we don't have those, or those were lost. But I would say my answer to your question, lawyer needed, I would say yes. If you need somebody to just, or a VSO or someone to just get a copy of your file so that you can actually look at it, or they can look through it and see what is actually in there. Are your service records in there? And then if not, maybe put out a request and try to get them. I wouldn't take that as well, they don't have my records and I'm not going to file. I would definitely work on it. It may be something that you need some help with to be able to kind of go through and track that down, but I do not think it's a dead end. And we hear it a lot, and we get the records a lot. So I think that sometimes it's just maybe a little bit of a miscommunication too, or maybe things are not said correctly. I'm not sure, but I would definitely encourage you to try, for sure.
I agree. Okay, we have time for one more question before we have to get out of here. Let's see. Too Hot Nas, what recommendations do you have for veterans whom are having issues with the VA healthcare, falsifying information, trying to reduce benefits? I feel like it is medical gaslighting. Oh my gosh. What's difficult is like VHA, Veterans Health Administration, and VBA, Veterans Benefits Administration, are two different entities. And I mean, that sounds absolutely horrible, that falsifying information. Am I surprised? No. Should I be? Probably. I would always, like, if you can get outside care somewhere else, if you have that possibility, or try to get a new provider, because sometimes you just kind of stick with the provider that they give you. But it's like getting a therapist. You've got to talk to different people and figure out who has the best relationship with you, who you build the best rapport with. So maybe whomever you're receiving treatment from is not the right person for you, and maybe you can try to get different providers. Also, what kind of condition is it for? Is it physical? Is it mental? Is it something that you can do telehealth with? And, that opens the door for getting something else. You could also provide statements from yourself and others discussing how the information in the record is incorrect. Shelly, what do you think?
I do like, I don't like, but I appreciate the term medical gaslighting. Just, I'm going to
Yeah,
remember that, just so
that's a good one.
moving forward, I'm going to be like, that's medical gaslighting. But yeah, I don't know other than what Allison is suggesting. It is the Veterans Health Administration and the Veterans Benefits Administration are just completely separate, like Allison said. I mean, sometimes we have a hard time getting them to consider the records from the VHA, and we submit them their own records and say, here, these are yours, you have them, but we're going to give them to you again. Please read them. I will say that we are seeing a ton of reductions. I don't know what cycle they're going through, but we have definitely been seeing a lot of reductions. If you're seeing that, then just know that you're not alone, and that most reductions are not proper. And you definitely want to appeal them, especially if it's based on one CNP, or you don't even know what it's based on. It's just come out of nowhere. The likelihood that it's coming from your VHA records, I don't know. But I do know that the reductions are happening frequently, and encourage you to definitely appeal those.
It's usually from a CNP exam. And I mean, my biggest thing with reductions is that they have to prove that there has been improvement in the ordinary conditions of your life, which they never consider. They usually base it off of one exam that probably wasn't very thorough, but your symptoms haven't changed at all. So absolutely appeal those. Like Shelly said, majority of them are improper, and you should definitely fight it. But you are not alone. We are seeing so many reductions. It's crazy. but you just got to keep fighting them. Just keep etching away at it, and eventually, you'll get what you should be entitled to.
Right.
Okay, well, it is 3:00. That is all the time we have for today. Thank you, Shelly.
Thank you.
Yeah, this was great doing this together, and we hope you all have a wonderful week. And 2 new people will come back next week and answer your questions. So be sure to add any questions you have, and we appreciate your service. I hope you have a great rest of your day.
Thank
Bye.
you.
You served your country, and now another challenge awaits. Getting the VA disability benefits you've earned. Too many veterans face endless delays and denials, and they shouldn't have to. At Hill & Ponton, we know the system and how to fight for you. Scan now to download The Road to VA Compensation Benefits, a free guide from Hill & Ponton, trusted VA disability attorneys. For over 30 years, we've helped veterans secure the benefits they deserve. Our free guide helps you avoid common mistakes and know when to call for backup. Scan now or visit hillandponton.com.